Monsoons are here, and after enjoying the rains, many of us are down with fever. So, here are 5 commonly indicated remedies for fever during this rainy season. First remedy is Rustox. Rustox is commonly indicated after getting wet, especially when the body is overheated, like after exercise or exertion. It's especially very good for typhoid fevers. Symptoms of fever are patient feels easily chilly with least uncovering. Patient wants to yawn and stretch during the chill. There's urticaria or wheals on the body during fever. There is pain in the limbs with the fever, and pain is as if sprained, and this pain is especially on first movement after rest or on getting up in the morning. And the pain is better by walking or continued movement. There's great restlessness with the fever. There's anxiety and apprehension, and patient cannot remain in bed. He must change position often to obtain relief from the pain. The tongue is dry, sore, red, cracked with a triangular red tip, and there's great thirst for water with dry tongue, mouth, and throat. These were the indications for Rustox. Second remedy is Antim tart. Antim tart is indicated for fevers from exposure in damp basements. There's coldness, trembling, and chilliness, and then fever is followed by copious, cold, clammy sweat. Along with fever, there's great sleepiness or drowsiness, and patients cannot keep his eyes open. Thirst is not constant during the fever. Face is covered with cold sweat, and there's great craving for apples. When the patient coughs, there appears to be a large collection of mucus in the chest, and in spite of that, the mucus is very difficult to bring out. These were the indications for Antim tart. Third remedy is Nux moschata. Nux moschata is indicated for fever after exposure to cold, wet weather or cold, wet clothes. There is alternate chill and heat. Sweat is absent. As the chill proceeds, patient gets drowsy and sleepy. There is an inclination to faint easily in this remedy. There is great dryness in the mouth without any real thirst. So there is cotton-like saliva, sticky dry lips, and the tongue is almost adhering to the roof of the mouth. Nose is also dry, stopped up, and patient must breathe through the mouth. There is great soreness of all the parts upon which the patient lies. There is great fatigue with desire to lie down. Fourth remedy is Pulsatilla. Pulsatilla is indicated after getting wet, especially getting the feet wet. Patient feels chilly yet is averse to getting heated or taking a covering. There is one-sided coldness of body parts. Patient feels feverish, hot, but body temperature is normal. There is an erratic temperature in the fevers. Body pains during the sweat. There is discharge from eyes, nose, and throat that is thick, bland, and yellowish green. Symptoms are changing. Like in Pulsatilla, no two chills, no two stools, no two attacks are the same. Patient is very well 1 hour and very miserable the next. Symptoms are like apparently contradictory. Pains are also shifting in nature. Patient is thirstless in spite of dryness in the mouth. The last remedy is Dulcamara. Dulcamara is indicated for fevers occurring during cold, damp, rainy weather, and worse when the weather suddenly becomes colder. Fever with dry burning heat all over the body. Chills are towards evening time, mostly in the back region, and along with thirst for cold drinks. There's icy coldness of the parts. Tongue is dry and rough, and there's scraping in the throat, and there are cold sores on the lips. Cold in Dulcamara settles in the eyes, so there is thick yellow discharge in the lids, and there is loose, rattling cough, and patient must cough a long time to expel the phlegm. Cough increases on physical exertion. So these were the 5 remedies to name a few, but it's advisable that you eventually reach out to your homeopathic physician for monitoring your health and treatment. Thank you.